All right, so I checked my doctor's orders for today, and he wants a head-to-toe assessment to be done on the patient. I have already checked her vital signs on her records. Everything is within normal limits, and her height and weight as well.
Come in.
Hi, nice to meet you. My name is Esmeralda. I'm with Texas Southmost College Vocational Nursing Program. I'm going to be your student nurse for today. I'm going to go ahead and make sure my breaks are on, and I provide patient privacy. Could I have your name and date of birth, please?
Valerie Perez, 04/19/1985.
Okay, awesome. So the doctor ordered a head-to-toe assessment to be done on you today. Do you need to use the restroom before we begin?
No.
Okay, and would you like to proceed in English or Spanish?
English.
Okay. So I'm going to ask you a series of questions. Please answer to the best of your ability. Your first question is going to be, do you have any allergies?
No.
Are you on any long-term medications?
No.
Have you suffered any trauma or surgeries in the past year?
No.
Okay, who drove you here today?
Myself.
Okay, do you know what season we're in?
Yes, spring.
Do you know who the president is?
Biden.
And do you know what month we're in?
Yes, May.
Okay, do you use any recreational drugs, chew or smoke tobacco, or take large amounts of alcohol?
No.
Okay, so that's going to be it for the first couple of questions. I'm going to ask you a couple of questions as we go through the assessment. I'm going to go ahead and begin with inspecting your scalp, and I'm looking for any signs of infestation, any lesions or bumps or lumps. Do you suffer from any dizziness or headaches?
No.
Okay, do you feel any tenderness?
No.
Okay, and I don't feel any unusual lumps. Awesome. Do you want to go ahead and remove your glasses for me? At this time, I would change my gloves one more time. I'm going to go ahead and assess your temporal pulse. Okay, and it's nice and strong bilaterally. And I'm going to go ahead and also assess your temporal mandibular joint. Go ahead and open your mouth and close it for me. Okay, and I didn't feel any popping, cracking, or any abnormal sounds. And I'm also, by the looks of it, I see that you wear glasses. Are you nearsighted or farsighted?
Nearsighted.
Okay, I can see that her sclera is nice and pearly white. I'm going to go ahead and pull it down, and I'm going to check your conjunctiva, and it's nice and pink. And I also can tell that her nose is nice and symmetrical to her face. I'm going to go ahead and ask you to tilt your head a little back for me. And I'm looking for any drainage, any bleeding, any lesions, or a deviated septum, and I don't see any of it, so which is really good. I'm going to ask you to cover one nostril and breathe in and out for me. Okay, awesome. Other nostril. Awesome. So now we're going to move on to your mouth, and I'm looking for any sign of cancer, any sign of lesions, anything like that. Okay, under your tongue. Okay, no signs of cancer there. Okay, go ahead and say ah for me. Okay, uvula was responsive. Go ahead and pull down your lip for me. I'm going to discard this. Okay, no signs of cancer in the gums. Okay, no lesions, cancer in the gums. Looks good. You want to stick your tongue out for me, wiggle it left and right. Okay, awesome. So now I'm going to go ahead and move on to your ears. I'm going to go ahead and palpate. Let me know if you feel any tenderness.
No.
Okay, and by the looks of it, I don't see any abnormal drainage in your ears on either side. I'm also inspecting the skin behind her ears. Looks good. Okay, I'm going to test your hearing. So what I'm going to ask you to do is cover your left ear for me. I'm going to whisper 2 words, and you're going to whisper them back to me. Is that okay?
Yes. Pink Panther.
Other side.
White cat.
Awesome, that was great. So now I'm going to move on to your lymph nodes. I'm feeling for the periocular lymph node, your post-auricular lymph node, your occipital, and I don't feel any swelling, which is good. We don't want that. I'm going to go ahead and feel for your submandibular. Okay, any tenderness?
No.
Okay, and your submental. And now I'm going to go down to your supraclavicular lymph node. And no swelling there either. I don't feel it, which is good. No tenderness.
No.
Awesome. So go ahead and raise your head up for me one more time. And I'm checking the symmetry of your trachea, which looks good. Do you feel any tenderness?
No.
Okay, great. So now I'm going to ask you to perform a little bit of range of motion with your neck. I'm going to ask you to turn your neck to the left, turn it to the right, up, down, chin to shoulder, other side. Now I'm going to apply a little bit of resistance on your left side. Go ahead and turn. Okay, other side. Awesome. So now I'm going to apply the same resistance to your shoulders. Go ahead and shrug them for me. Okay, great. Now I'm going to palpate your extremities. Let me know if you feel any tenderness in your extremities. Any tenderness?
No.
Okay, now I'm gonna check your capillary refills in your nails. Okay, capillary refills are less than 3 seconds, which is what we want. I'm also checking your radial pulse, nice and strong bilaterally, and your ulnar. Great, and then your brachial pulse. Okay, sounds good, feels good. Okay, now we're gonna go ahead and assess your lungs. I'm gonna start with your posterior side, so I'm gonna turn you this way over here. All right, so first off, I have already noticed as I'm talking to her that she doesn't have any trouble breathing. That's noticeable. I'm gonna go ahead and palpate. Do you feel any tenderness?
No.
Okay. Okay, and I'm going to check for any kidney pain. So I'm gonna go ahead and percuss. Let me know if you feel any pain or discomfort.
No.
Okay, you're gonna feel another one.
No.
Okay, awesome. Right, so now I'm gonna check for CVA. I'm gonna put my hands right here in your 10th rib, and you're gonna go ahead and breathe in and out for me. Okay, lung expansion was symmetrical. Now I'm gonna go ahead and auscultate for lung sounds. Go ahead and just relax for me. All right. Go ahead and breathe in. Okay, everything seemed normal. I'm gonna go ahead and assess your lateral side. Go ahead and turn this way for me. Okay, go ahead and raise your arm for me really quick. Alrighty, so we're gonna check your right side. I'm also gonna auscultate in your 3 parts. Go ahead and breathe in. Okay, one more time. And one more time. Okay, now I'm gonna turn it to the other side. Go ahead and move your body on the other side. All right, go ahead and raise your arm for me. Go ahead and breathe in. One more time. Okay, looks good. All right, so now we're gonna check for your lung sounds in the front. Go ahead and turn to the front. Awesome, there you go. First, I'm going to palpate. Okay. Let me know if you feel any tenderness.
No.
No?
Mm-mm.
Okay, what about down here?
No.
Okay, and I'm also gonna check your lung expansion in the front. Go ahead and breathe in and out. Okay, was symmetrical bilaterally. Now I'm gonna go ahead and auscultate for the sounds. Okay, breathe in. Okay. One more time. And one more time. Okay, awesome. I didn't hear any abnormal wheezing, so her breaths were normal. I'm gonna go ahead and assess your heart sounds now. Do you suffer from any heart failure? You said you didn't. How's your caffeine intake look like?
It's normal. One cup a day.
Okay, awesome. So first I'm gonna locate the apex of your heart. I'm gonna go ahead and move your breast a little bit. I'm gonna feel for it. And then once I find it, I'm going to auscultate for 1 full minute. Okay, then it was within normal range. So I'm gonna go ahead, once I do the apex, I'm gonna go ahead and move to the aortic. So that's gonna be 2 intercostal spaces. That's your aortic artery. Nice and strong. Now move down to your pulmonic. 1 intercostal space down there, it'd be your Erb's point. Right, and now we're gonna move down to your tricuspid. Okay, it looks good. And then we're gonna do 1 more time on your apex. Okay, looks good. Now I'm gonna go down to your abdominal aorta, which would be in your epigastric region. Okay, and looks normal, sounds normal. And I would repeat these auscultations with the bell of my stethoscope. Okay, so now I'm going to ask you to perform a little bit of range of motions with your arms. You're gonna go ahead and fold your elbows for me, please. Okay, extend them. Okay, now you're going to fold them one more time. You're gonna extend them with a little bit of pressure. There you go. And then you're gonna pull them towards you. Awesome. Go ahead and out to your side. Big circles, okay? All the way up to your neck. Okay, and then all the way down to the back of your lower back. Awesome. That was great. So I'm gonna ask you to come and lay down over here for me. We're gonna do your abdomen. Alrighty. Alright. So first I'm going to auscultate your 4 quadrants. Make sure we have some bowel movements. How are your bowel sounds, bowel movements like?
They're normal.
Okay.
Nice and firm once a day.
Okay. And I will listen 5 to 20 seconds each quadrant. Okay. And bowel movements are within normal. I could hear them, which is great. Now I'm going to go ahead and palpate your 4 quadrants as well. Let me know if you feel any tenderness.
No.
No?
No.
Okay. Right. I'm gonna go back and auscultate your epigastric region one more time as you're laying down. Okay, that's good. Now I'm going to percuss your 4 quadrants as well. Okay. Okay. The sounds were normal, so now I'm going to feel for your bladder. You might feel the need to void, and it's normal. Okay, I feel it. Do you feel the need to void?
No.
Okay, awesome. Okay, so now we're gonna move down to your to the genitalia part of the assessment. For this, I'm gonna make sure the room is alone. I'm gonna place my patient in a recumbent position. Okay. So what I'm looking for, I make sure I jig my patient. What I'm looking for are any signs of STDs, any unusual drainage, any signs of bleeding that is not within her menstrual cycle. I'm also looking for any lesions and overall skin integrity and hygiene. I'm gonna use my non-dominant hand to spread the labia majora and inspect for all that. And now I'm gonna move down to her rectum, which I would inspect the same thing. Any signs of lesions, bleeding, any signs of hemorrhoids, any sign of overall hygiene as well. So we're done with the genitalia part of the assessment. Now I'm gonna move on to your lower extremities ranges of motion, and I'm also gonna check your pulses. First, I'm gonna palpate to see if you have any tenderness. Let me know if you do. I'm gonna start at the hips, and I move down. Any tenderness?
No.
Okay. And then I would take your shoes off. And I'm gonna feel for your dorsal pedis pulse. Okay, and it's strong and bilateral. And I'm gonna check your posterior tibial pulse. Okay, and it's symmetrical. And then I'm gonna check your popliteal on both sides. All right, and then I would also check your femoral pulse. Awesome. All right, so now we're gonna perform a range of motion. So first we're gonna start with your knee. We're gonna go ahead and bend all the way through and extend. Awesome, and then you're gonna go straight up. Okay, great. Now off to the side. Awesome. Now I'm gonna perform your ankle. Point your toes. Okay, now your toes. Okay, and I don't see any sign of edema on this extremity. Now I'm gonna do the other side, your knee first, all the way through, awesome, and then straight up. Great. Now I'm gonna go off to the side, okay? Now you're gonna point your toes for me, okay? And then up, now your toes, down, okay? And I don't see any sign of edema either, which is great. Now I'm gonna help you up. Okay, I'm gonna have you sit in the chair. We're gonna perform an exercise called Get Up and Go. So I'm gonna have you sitting here, and I'm gonna ask you to stand up and take a few steps. No assistance of the chair or anything around you, and I'm gonna follow you the whole way through. Go ahead. Okay, go back to the chair, and you're gonna sit without any assistance. Okay, that was great. So we're done with the head to toe assessment. Everything was in normal limits. And we're gonna wait for your doctor to come in and give you more instructions. Okay.